Welcome to the McLean Hospital Crafting Support Project 2025 Family Webinar Series. I'm Dr. Julie McCarthy, and I'm a clinical psychologist and researcher at McLean Hospital. Tonight, I'm very excited to have you with us for a presentation on navigating housing for mental health recovery with Dr. Danna Mauch, Jessica Larochelle, and Kate Alicante from the Massachusetts Association for Mental Health, or MAMH, which is a nonprofit organization that promotes prevention, early intervention, effective treatment, and research to address social, economic, and mental health challenges and strives to eliminate stigma and discrimination to advance overall health and resilience. Before we begin, I'll go over a few reminders. Folks are welcome to change their names for privacy or make questions or comments in the chat anonymously. Please try to enter any questions you would like answered in the Q&A box, and we'll be answering questions at the end of the presentation. And then we'll ask that you use the polls or chat for audience participation and to share any comments, resources, etc. that you would like. And we'll be recording the presentation and Q&A discussion. And when recordings are available, we'll let attendees know. And to continue to improve the webinar series, we encourage everyone to complete a brief anonymous voluntary feedback survey just to share your thoughts, preferences, and ideas for future webinars. This information will help us for quality improvement and may be shared anonymously in the future with others like researchers or people interested in working with us to expand support for family services. So I will put that in the chat for anyone who might need to go early. Okay. All right, so first up, we will be going over a brief introduction of the Crafting Support Project, kind of why we're here today, and then we'll go into the presentation, and then we'll spend the last about half of the presentation doing a Q&A, and then we'll end with a few closing remarks. So before we jump into what the webinar is about, let's talk about who's with us today. So I'm going to launch a poll, and I'd love you to share what your role is as an audience member today. So if you feel comfortable, please feel free to describe whether you identify as a family member, person with lived experience with mental health challenges, clinician, none of the above, or you can have intersecting identities as well. Okay, so we'll close the poll in 3, 2, 1. Okay, so we have primarily family members with us, and we also have folks who have personal lived experience with mental health challenges and clinicians as well. So welcome. All right. So if you're with us tonight, maybe you've been with us before for past webinars, or if you are new, part of the reason why we had started this webinar series, the Crafting Support Project, is because I and many of the people that I've worked with have found themselves in positions of really not knowing how to best support their loved ones, or maybe not knowing what the best decisions were about things like housing or how to support one in achieving their recovery goals. And so there are not necessarily, one set of answers for everyone. And so thinking about how we could learn more about different resources that have evidence behind it to help families like yours is really where this initiative came from, with the generous support of our donors. So we have our wonderful series of webinars this year, and we also have past webinars on YouTube. And we also offer one-on-one coaching as well, which we are in the process of transitioning to an insurance-based service for families as well. So this is for people who are in Massachusetts, or people who are family members of folks who have loved ones who have come through McLean. So if you're interested, let me know, and this can all be done virtually as well. Okay, so before we get to our main event, I'm going to ask a little bit more of what people's experiences have been like with respect to housing. So the next question is really thinking about helping a loved one. So I'm curious, yes or no, who has helped a loved one to find housing outside of your household? So at any point, could be any time in the past, you might be in the thick of it now, or you anticipate this something that you might encounter in the future. Okay, we'll give folks another second or two to log your answers if you like. And we'll close the poll in 3, 2, 1. All right, so it's about half and half. So about 46% of folks have said No, they haven't crossed this path. And a little over half, 54%, said that they have had been in the position to help a loved one find housing. Okay, so relatedly, another question would be, well, have you ever felt uncertain about how to find or finance housing for a loved one? Because just because we may realize that we may need to offer some help or assistance to someone, it might be a whole other question entirely about how to go about doing that. And so a lot of answers are coming in very quickly for the yes option. Um, and we'll give folks a few more seconds to respond if you'd like as well. And we'll close the poll in 3, 2, 1. Okay, so 93% of people who responded said that yes, they have felt that uncertainty about how to navigate housing. So you are in the right place today. Thanks so much for being with us. Okay, so now I'll turn things over to our folks at MAMH on navigating housing for mental health recovery, a little bit about their backgrounds. With us tonight, we have Kate Alicante, who is the Senior Policy Research Associate at MAMH, who earned her Master's in Public Health from Boston University School of Public Health with a concentration in health law and policy. Kate previously worked in the Joint Committee on Public Health at the Massachusetts State House as a research analyst, and she currently collaborates with a range of community partners on executive, judicial, and legislative branch initiatives. We also have with us Jessica Larochelle, and she's the co-director of Public Policy and Government Relations. Jessica earned her master's degree in health policy and management from the Harvard T.H. Chan School of Public Health. She has worked as field director for Families USA, a Washington, D.C.-based nonprofit consumer health advocacy organization, and as executive director of Consumer Health Coalition, a nonprofit dedicated to expanding access to quality, affordable healthcare in Pennsylvania. And last but not least, we have Dr. Danna Mauch, who is the president and chief executive officer, and she holds a PhD in social policy from the Heller School at Brandeis University. Dr. Mauch has served in the private sector, including 10 years as senior fellow and principal associate at Abt Associates, Inc., and she's also had a long career in public service, including serving as court monitor for the U.S. District Court of Western Washington to address forensic service reforms at the junction of health, disability, and justice systems. And she also previously served as assistant commissioner of the Massachusetts Department of Mental Health, overseeing divisions of mental health, substance abuse, and forensic medicine. So all very important things. So thank you so much for being with us.
Thank you very much, Julie, for introducing us. And I'm going to briefly introduce this discussion and then turn it over to my more than capable colleagues, Jess and Kate. And then together we'll be available to answer your questions. I just want to thank McLean and Dr. McCarthy for convening us this evening. I have a long history with McLean Hospital around the subject of housing people who are leaving hospitals in the community. Many years ago, my first job in the Department of Mental Health was to be a Department of Mental Health area director, responsible for all the home and community-based services, as well as the state hospital services and developmental disability services in a geographic area of the state that included the area in which McLean resides. In fact, so Metropolitan State Hospital, your former neighbor, now closed, was our hospital. And when we were beginning to build our community system, and the core of that system was housing for people, at the same time, McLean, and this is in the latter part of the 70s, McLean was taking leadership in this area for the patients leaving the hospital who needed housing. So Wildacre Inns, which still operates, was founded by Dr. Bernie Udowitz, one of the psychiatrists at McLean. The Task-Oriented Communities was founded by Dr. Amos Nayor, another McLean psychiatrist. And it was my job in the Department of Mental Health to license and monitor those programs. So I was very familiar with them. And the hospital, McLean Hospital, was very involved with us in our area as well as in the state hospital, providing physicians to staff the wards of the hospitals, helping with the leadership of our area board. Your director of social work was actually our area board president, Golda Edinburgh. And anyway, so there's a early and long history now of McLean's involvement in not just referring people to housing, but developing housing. And I know a big function of the work at Waverly Place, which was founded later, and Dr. Paul Barrera, a member of the MAMH board, used to run that years ago. That they focused a lot on helping people to find housing and providing the supports that people needed to live in the community. The needs of people for housing as a core stabilizing effect in what's come to be known as a social determinant of their mental health and well-being has not changed in these 40 plus years. How we go about organizing and financing that has changed somewhat, and MAMH has been integrally involved in that. McLean, under leadership of past directors, Dr. Mirren, and now Dr. Roush, has been a partner to MAMH in supporting our advocacy work, particularly in collaborating with our housing advocacy and leadership on developing rental subsidies to underwrite people to get into and live in market-based housing, market rate housing, I should say, subsidizing those rates. So Jess and Kate are going to talk more about those developments. But I just want to say this is not a new topic for McLean, nor is it for us. And in also years past, when MAMH would publish our reports, and we have a couple of slides just showing some images from these reports. Maybe Jess could advance those slides. We've published reports called People Are Waiting about all of the people who were stuck often in hospitals, including McLean and other hospitals, awaiting housing, which is, long been in short supply and not that affordable for people who lived with disabling mental health conditions. And so we're relieved that that picture has improved over the years, and we have continued to publish our People Are Waiting reports. And most recently, as Jess will discuss, published last year a larger report that is about all of the housing programs and options in the Commonwealth, and particularly about how to develop and finance affordable housing for people who live with behavioral health conditions. But the title of the report is People Are Still Waiting. We still have a huge number of people in need, and we don't have sufficient resources to meet that need. That said, I don't want to discourage people on this call, because there are ways to find resources and develop resources and seek housing, and hopefully we'll be able to share some of that with you this evening. So I'm going to turn it over now to Jess, and thank you for your time. And will you talk about the State Mental Health Planning Council, Jess? I should say one of the ways that we try to advance advocacy for housing is through the State Mental Health Planning Council, which I co-chair, and which Kate is involved in co-chairing the housing subcommittee. And they'll talk a little bit more about that, because it's a great opportunity for people from across the stakeholder groups in the community to join the discussion and formulate policy positions and formulate strategies for accessing more resources for housing in the Commonwealth.
Thank you, Donna. So yes, I will talk a little bit more about the housing subcommittee that is a part of the State Mental Health Planning Council. I started co-chairing the subcommittee. Just a little bit of background. Massachusetts has a state mental health planning council, but most states have a state mental health planning council because any state that receives a community mental health service block grant, it's a requirement of that grant for the agencies to have these councils, and they're funded by SAMHSA. And the whole purpose of these councils is for them to advise state agencies, in our case in Massachusetts, the Department of Mental Health, and to advise them on mental health services, but also to advocate for individuals with mental health needs and monitor the state's mental health service system. So in Massachusetts, we have a pretty robust council. We have a range of subcommittees that focus on things such as employment, young adults, older adults, peer supports, and obviously why we're here today, housing. As Donna mentioned, MAMH has been working on this, McLean has been working on this, and I think we're very thankful that in Massachusetts, the Department of Mental Health also very much recognizes the need for housing and mental health recovery. Just a little bit of some of the work that we've been doing through the housing subcommittee. So recently DMH has been working on their housing plan, trying to create what their strategic vision and how they will accomplish their goals over the next 5 years. So as members of the housing subcommittee, we've been able to provide input and work with them to keep updating the draft and making it better. In addition, we have a group of largely providers who we call our Housing Access Collaboration Work Group. And it's kind of like a learning think tank for, different housing providers to see how they can best help the people they're serving. But we also have people who access those services, and it's all just a way to troubleshoot how we can make the programs work better that DMH provides. And lastly, as Donna mentioned, a big part of the housing subcommittee is our advocacy work. And so that's the group that I lead. And, I have my email address at the bottom there. We are always trying to welcome more members into our housing subcommittee. The more diverse experiences, whether you are a person who has the lived experience of having mental health needs, or if you are a family member, that's personally how I identify as well. We welcome all of those thoughts and perspectives because it makes us better be able to advise DMH. So again, there's my email, and we really welcome anybody to join our housing subcommittee. Jess, can you go to the next slide? So speaking about a little bit about our advocacy, MAMH has also done a lot of work to advocate for this DMH rental subsidy program. Like I said, it is, we all really appreciate that DMH has recognized the importance of housing. So the department has its own rental subsidy program, its own rental voucher program that is specifically for DMH clients. And so clients, as you can see, pay 30% of their adjusted income towards the rent, and then rental vouchers cover the balance. And then in order to be eligible for the program, right, it's just a person who's receiving DMH services, and then you also would qualify based on your income. And then, just to explain a little bit of adjusted income, it takes into account, for example, if your family member has medical expenses, monthly medical expenses that are documented, that could be used to help lower the rent. So in addition to helping individuals financially with the rental voucher, individuals also get services through the community providers to support their tenancy, health, and recovery. So some of those services include just helping setting up utilities, making sure that, the 30% that they do pay gets to the property owner. They also offer help maintaining cleanliness, help with money management, help integrating into the community, offering transportation assistance, helping anybody seek employment. And the support ranges from clinical support to also peer support as well. And the great thing with this program is they have your service provider is with you the whole way from once you are identified as a person who could benefit from this program, to helping you find the housing, to helping you stay in the housing. So there's someone with you every step of the way. And so through the housing subcommittee, through, MAMH, we're really happy and fortunate that we've been able to grow this program. Over the last 8 years, the budget has grown nearly 5 times as much. And so currently the DMH RSP supports over 2,500 vouchers for our DMH clients. So that's a little bit about the program, but we have a video linked here if you would like to know more about the details of how the program works. Great. Thanks, Jess. We could go to the next slide. So again, housing is a big part of MAMH's portfolio of the things that we care about when trying to address a person's mental health needs. We are also part of the Massachusetts Supportive Housing Pipeline Coalition. So this is a diverse coalition of more than 80 nonprofit and for-profit developers. It includes healthcare companies, service providers, policy organizations, advocates. We're all working to scale supportive housing options. And again, ensure that those with the most to gain from a home have what they need to heal and thrive. So it's led, as you can see, by the United Way of Mass Bay, CHAPA, the Western Mass Network to End Homelessness, us, MAMH, and the Massachusetts Housing and Shelter Alliance, also known as MAHASA. So even in the leadership, you can see that it's a range of housing organizations, and then organizations like us that really also do a lot on the supportive side as well. So Jess, if you go to the next slide, I can talk a little bit more about some of the priorities of the Supportive Housing Pipeline Coalition, particularly around the budget. The governor just signed the final budget for FY26. A lot of our advocacy, both through the Housing Subcommittee at MAMH, through the Supportive Housing Pipeline Coalition, is to just grow the funding for these programs. You can see the DMH rental subsidy program, which I described earlier, that we've grown about 5 times, is right there. This year was definitely a tough year. And, as much as we try to grow the program, something we're very thankful for is we were able to keep all these programs level funded. So no cuts to the services that we already know are at capacity. And in particularly, I also really want to call out, we've done a lot of work with all the coalitions we mentioned here and other behavioral health organizations to make sure the DMH adult services and supports line item is fully funded. It was facing a possible $24 million cut that was going to impact largely DMH adult respite and DMH adult community clinical services, which I really just wanted to highlight here because those things are also incredibly housing related. Adult respite, for anyone who doesn't know, is it's kind of a transition or bridge program. And what it does is helps adults who are boarding or stuck in our EDs transition into more community-based therapeutic care. And so that's what respite is. And then ACCS, or Adult Community Clinical Services, what that is comprehensive clinical interventions, also peer and family support, and vocational support and housing support. So a lot of the time people may get ACCS and also that DMH rental subsidy program that I talked about earlier together. So, and about 75% of people who are getting DMH community services are getting ACCS. So again, it was really important to us that we stopped that $24 million cut because we know so many people depend on those services, and we know that they're working and we know that they're, completely full. So that's a little bit about the money side of things. To the next slide, the Supportive Housing Pipeline Coalition has also been working a lot on the legislative front. Last session, they filed a bill to create a supportive housing pool fund. And so what that fund is, it's a flexible pool program to provide critical assistance for supportive housing. And it's a place where, people, the agencies could get funds for staffing or the case management or the service coordination or all the other sort of tenancy related services not funded through other sources. And so last year, a big housing bill passed called the Affordable Homes Act, and the Supportive Housing Pool Fund was a part of it, which we were very, very happy and excited about, in addition to all the other things the Affordable Homes Act did, which include also having the Executive Office of Housing Livable Communities create a statewide housing plan. And so the coalition has been very involved in, one, with the fund, making sure that we're, in communications with the executive offices to provide feedback and guidance around that implementation of the fund, so that public and private resources could be braided to better create supportive housing. And also we were very involved with informing the creation of the statewide housing plan, and just making sure that even once the bill passes, that we are in constant communication and providing feedback to our government about how to make sure that the intents of the law is happening. And so, as you can see, we're part of a listening session with the Executive Office of Housing and Livable Communities, and also responded to their request for information. And then lastly, this session, at least on the bill front, we are building on the creation of the fund and trying to work on making sure that the money actually is distributed and works. And so finally, we have a bill that's called an act to create an interagency supportive housing and finance strategy board. And Jess, if you go to the next slide, you can see a couple talking points about the bill, again, building off of the fund to just create more supportive housing units and get that ball rolling. So again, these are just a couple of the things that MAMH is doing in close collaboration with a lot of organizations who are doing work on this. We talked about the RSP that, again, is a program that has been really helpful for DMH clients. And again, all these programs are at capacity. So a lot of the work with this coalition is to just have more supportive housing options for people. So I will turn it over to Jess now.
Thank you, Kate. Donna, Kate, and I wanted to share with you all a few more resources and some information so that you can either help yourself or someone you care for, or perhaps one of your clients, secure quality, affordable housing. There's 3 resources listed on this slide. The first one is called Housing Consumer Education Centers. Every city and town in Massachusetts is assigned to a regional housing consumer education center. And they're available to answer a wide range of questions related to different housing problems. And they're for everybody. They're for tenants or prospective tenants, for landlords, for homeowners, or people who are interested in buying homes. And they also offer resources related to homelessness, emergency housing assistance, housing options, shelters, and supportive services. And we included on this slide a link where you can find your local housing consumer education center to reach out with the contact information and get the help that you might need. Another resource that we highly recommend is NAMI, Massachusetts. They operate a helpline called Compass. And even though the Compass helpline is designed for people with behavioral health conditions and their families, our friends at NAMI tell us that the #1 type of call that they get on their helpline is actually housing questions. So it really speaks to the intensity of the need and the affordable housing crisis that we're encountering in the Commonwealth that Donna and Kate spoke to. So the number for the Compass helpline is on your screen. It's free, it's confidential. It operates during business hours. NAMI also produced a wonderful guide to help people find and keep housing that's on their website, and the link is there. And then a final resource that's sometimes overlooked are the independent living centers. And again, there's a network of independent living centers across the Commonwealth of Massachusetts. We put the link on the screen, and Julie, if it's okay, we're happy to share all of our slides so people can find the independent living center closest to their home or their community. Independent living centers serve people with all types of disabilities, including disabilities related to their mental health condition. So we also encourage people to reach out to their local independent living center or ILC. This next slide includes housing search resources for people looking for affordable housing. So Housing Navigator Massachusetts, it's a website search tool. You can see the URL on your screen. And you can search for rent based on your income. And what that means is you enter in your income and they will cap the rents for the properties or the apartments that they show you as a portion of your income. It's usually 30%. Folks might have heard of something called the Mass Accessed Housing Registry. This Housing Navigator Massachusetts has replaced that resource. So we encourage you to check that out. And if you live in the Boston area, we also encourage you to check out Metro List. It's one of Boston's primary resources to find income restricted housing. So if you're outside of Boston or in Boston, anywhere in Massachusetts, Housing Navigator Massachusetts is a great resource. And if you live in Boston, you can also leverage Metro List. So there are some resources that Kate and Donna were talking about these before that are specific for people who are a client of the Department of Mental Health. So DMH operates the rental subsidy program, which Kate did a wonderful job explaining. They also operate something called safe havens, which are low threshold housing for chronically homeless individuals. These individuals literally help folks who have a hard time coming inside and often who have had trauma histories. And that's a safe haven program. They also operate homeless outreach teams or projects for assistance in transition from homelessness. It's a bit of a mouthful, but the acronym is PATH. And the way to access any DMH services is if you're interested in becoming a DMH client, it's a two-step process. You first fill out an application. That's the first step. And then the second step is that your needs are reviewed and you go through a service authorization process to determine out of the suite of DMH services, which ones are the best fit for your needs and where is their availability. So if you already are, or once you become a DMH client, and if you're interested in accessing some of these housing programs, including the rental subsidy program that Kate talked about, the first thing you can do is contact your DMH case manager. You can also contact your area housing coordinator. So DMH is divided into 5 areas or 5 regions. Each region has a housing coordinator. And we put the URL, the web address on the slide, so you can identify which of the DMH regions services your city or town. There's contact information, and then you can reach out and ask to be connected to the housing coordinator to get connected to the DMH housing resources. And something that's not on this slide, but I also wanted to mention, in addition to resources specific to DMH clients, there's also resources specific to Mass Health members. In order to get a lot of these housing resources, you have to be enrolled in a Mass Health Accountable Care Organization or an ACO. People on I'd say more than about half of Mass Health members are part of ACOs. You might have heard of the Mass General Brigham ACO, a WellSense ACO, a Community Care Cooperative ACO or C3. Those are the 3 of the biggest ones, but there are 17 in total. So if you are a loved one or part of a Mass Health ACO, you can get some housing support through something called a community support program. And there's 2 different kinds. One is for people who are currently homeless, and they can get help with housing search, and they also can get help with housing transition. So for instance, they might be able to get help paying for their first month rent, or they might be able to get help paying for furnishing. The other community support program for Mass Health members who are part of ACOs is called the Tenancy Preservation Program. So this is for people who are housed, but who might be at risk for eviction. And this Tenancy Preservation Program can assist people and families with talking to a landlord, or might be able to help people get some legal help. So if that is relevant to you, we recommend talking to your Mass Health case manager or your community partner organization. And kind of stepping back a little bit more on tenancy preservation, the resources on this slide are for everybody. You don't have to be a Mass Health member. These are a list of rights for people and families regarding eviction, including the right to reasonable accommodation. And they're all linked here. So when you get the slides, you can click on all of these and find more information. But I really want to thank our partners at the Disability Law Center. MHLAC is the Mental Health Legal Advisors Committee, and MLRI is the Massachusetts Law Reform Institute, for publishing these key resources to help people who might be facing eviction or potential eviction understand their rights and hopefully sustain their housing. And then lastly, there's a resource on the slide. This last one on the slide is for people who are residents of DMH community housing, to understand what their rights are under the Massachusetts law. And that's also provided by the Mental Health Legal Advisors Committee. And if these are relevant or interesting to you, again, you can just click on the links of these slides when you receive them after the webinar. So finally, we wanted to end where we started. And Donna was talking about the people are waiting report, and Kate and Donna were talking about the housing subcommittee, and both McLean's and MAMH's legacies and long histories of working to increase the supply of affordable, quality, supported housing. And I think what we want to leave you all with today is that there are a lot of resources available to help, which we've included in this slide deck. And there's also still a long way to go. And to make sure that everyone in the Commonwealth does have access to quality, affordable housing, it's going to require all of us. And we encourage each and every one of you on the webinar tonight to get involved. You can read the People Are Still Waiting report that's on our website. You can click on the URL, the link, and you'll be directed to it. You can email Kate, there's her email address again, to join the Housing Subcommittee of the State Mental Health Planning Council. And you can also sign up for our mailing list. MAMH publishes a newsletter every single month. And we also send out regular action alerts. And I can tell you that in the coming months, we'll be trying to get more funding for the rental subsidy program and the Safe Haven program, because these programs are excellent. They make a very big difference, but there isn't enough supply to meet the demand. So we hope that you'll join us and work with us to expand those programs and housing opportunities for all. With that, I'll stop sharing slides and turn it back to you, Julie.
Thank you so much for such a wonderful presentation. So now we'll move on to our Q&A. So if folks have any questions, feel free to put them in the chat. And I'll get us started with a question that has come up at times in the past. What recommendations do you have for family members or people, themselves wondering whether or how to share their or their loved one's mental health status with roommates, landlords, and or housing services, so that they can, respect their own privacy and also sometimes think about when it might be useful to provide helpful context for why people might need additional assistance or understanding?
So I'll answer that. People have no obligation and have, in fact, every right to privacy regarding their health conditions. no one would be expecting a person to disclose that they had diabetes to a landlord, right? No one would be expecting to disclose a heart condition to a landlord, even though these are things that might worry some people and, occasion a wellness check or something for somebody who might be ill and not able to help themselves and answer the door or whatever. There's no obligation, and it's typically not done. That said, and there certainly isn't with mental health, and people have been, obviously because of the stigma associated with behavioral health conditions, people have been loath to share that information. So it's good that there are those protections. That said, there might be times when it's a reasonable decision to make on an individual basis. I actually recently went through this in moving my nephew, who lives with schizoaffective disorder and is served by an assertive community treatment team. In moving him to a new apartment, just happened on June 30th, so this is fresh in my mind. And we did not disclose to the landlord what his diagnosis is or his treatment, but we had to explain. So, the lease was signed, et cetera. But there's a building manager who has a little office on the first floor of the building who was wondering why people were coming to see him, because he has a case manager who visits. Actually, today his nurse was there to deliver some medication to him, the nurse on the team. So we did disclose to them that they should expect to see people who come because he has some health conditions that are being treated. Actually, the nurse was there today to provide him insulin and his supplies because he sadly developed diabetes as a result of the atypical antipsychotic medication he was prescribed. So I don't think this is an uncommon situation, but as a family member, I would not disclose his illness to people. It's really not their business, and it is sometimes an occasion for discrimination, and we have to face that reality. On the other hand, if you're depending on someone in the building or it's a group living situation, I mean, if an individual is moving into a group house with people and it's not organized around supporting people with mental health or recovery needs, individuals may choose to disclose that to their roommates, but there's no requirement to do so.
Thank you so much. Another question that had come in was knowledge about resources outside of Massachusetts. So say if someone is elsewhere in the country, for instance, state of Washington, are there resources that you could suggest, for someone who might be in the process of dealing with eviction?
Massachusetts, you mean? Dealing with eviction? I'm sorry.
No, so dealing with eviction outside of Massachusetts. I know it's not possible to know every single resource in other states. This question was about Washington.
The state of Washington or
the
Washington?
The state of Washington.
Okay. I happen to know that state pretty well because
Oh, wonderful.
I serve as the
Yes.
monitor for the U.S. District Court of
Right.
Western Washington in a case involving people who have these conditions and who are detained in jail and then in hospitals for competency to stand trial services, and housing's a big part of the solution. So there are some very good advocacy organizations. There is Disability Rights Washington, which is drw.org. I can send you a link to a lawyer there if that would be helpful, or I'll put it in the chat, okay? So they represent individuals with mental health and behavioral health conditions, as well as people with intellectual and developmental disabilities. They are the protection and advocacy system partner for the state of Washington. And then there are different housing advocacy organizations in the state as well for people facing eviction. I don't know what county the person's having a problem in, but there are county level resources, whether it's King County or Whatcom or Spokane. I don't know if you know the county, I could probably get you someone to talk to in a particular county.
It looks like it was King County.
Yeah, okay. I'll put a couple of things in the chat, and I can also send you an email afterwards, Julie, if you know who the individual is.
Sure.
Them.
Okay.
Okay.
Sounds good. Thanks so much.
Thank you.
All right. So another question is, let's see, thinking about how to balance, supporting someone's independence and living on their own, and also knowing that they might need certain levels of support. What are some key steps for individuals and families to think about to feel most prepared to try independent living, maybe for the first time for a loved one, or maybe the first time in a while? Because sometimes I think the question about is now the right time, or am I ready, or are they ready, comes up. And this could be for anyone.
Sure, I can answer for someone who's involved in as a client of the Department of Mental Health. So the decision to move into a studio or one-bedroom apartment, it's usually made in consultations between the individual, the family, and the person's care team. And oftentimes, if they're part of adult community clinical services, ACCS that Kate was talking about, which serves about, as Kate said, 75% of adults that receive DMH community services, and the individuals getting care from a community provider. So some examples are VinFen or Elliott or Riverside or Center for Human Development, a large community mental health provider in the state. And the team will have a lot of conversations with the individual and the family as part of their goals and treatment planning to see if this makes sense. And oftentimes the person is in a group living environment and thinking about moving on to a studio or one-bedroom apartment, or perhaps they are living at home with other adult family members and thinking about moving out. And one of the beautiful things about the rental subsidy program is the voucher itself helps pay for the rent, but there's a lot of other support, but besides the financial support, there's all the clinical support that Kate was talking about and the tenancy support, because the goal is to help the person be successful and maintain recovery with more independence, and move on. If that pathway is for them to recovery, to be successful moving on that pathway.
Great. Thank you so much. So it really sounds like kind of a group effort to think about what the best resources and supports are for that person.
Mm-hmm.
So I know, I think it may have been you who had mentioned, or someone else, that some of the programs are somewhat at capacity. And so how long might someone be able to get support, in terms of amount of time? Is it a number of months or years, or kind of as needed once someone's in one of these housing support programs? And for instance, like the voucher program. Oh, I think you're muted, Donna.
Are you asking how long a person can stay?
Yes.
The vouchers should be available to people indefinitely.
Okay.
And there are several kinds of vouchers. So there are some that are exclusive to people who are an enrolled Department of Mental Health client. And for families or individuals who live with these conditions, who might be on the call, if you are not registered with the Department of Mental Health and are seeking affordable housing and wraparound services and might qualify, you should take a look at applying through, and you can find a link on the website at mass.gov in the Department of Mental Health for an application, which goes to the DMH site and area offices. It's not a complicated application, but they don't actually qualify you overnight, so it does take some time. But there are also rental subsidy programs that are administered, as Jess said, by the Department of Housing and Livable Communities. And people do not have to be a client of the Department of Mental Health to qualify for these. So some of them are funds that are targeted to people who live with mental health or substance use conditions, but are unstably housed or homeless. And those, one can apply for those as well. And there are people who can provide assistance in some cases. This is one of the things that the Compass Healthline does. They help people in applying for some of these benefits. I don't know if Jess or Kate have anything to add to that.
I'll just add that, Julie, I thought your question was more like how long do you have to wait to be able to get on the voucher program?
That was going to be my next question.
Oh, okay. All right. So
feel free to answer that.
Okay.
No. No, Donna answered you answered Julie's question. This is on my end. I think it's worth noting that with the rental voucher program through the Department of Mental Health, there still are some vouchers available.
Okay.
And Kate was describing that, funding is constant for next year, but they are still issuing some vouchers. We have heard that some of the other voucher programs are freezing. And like, not to be political, but just to be factual, there's less money coming from the federal government for some of these voucher programs. So there is less opportunities. So I think it's reasonable to expect the waits to get longer, sadly, in the future. But as of right now, I believe the Department of Mental Health is still issuing. And Kate's nodding. She knows as being the chair of the co-chair of the housing subcommittee that they still are issuing vouchers.
Gotcha. Thank you so much.
you.
And I guess, say there is a conflict between some of the parties that you had shared ideally would be working together to make housing decisions and support, a loved one to find housing. What resources are available, or how do some of the housing organizations maybe approach conflicts between what one person in a situation or in a family might feel like is the right housing choice, and then another family member thinks that a different choice is the right one? I'm not sure how often those types of conflicts come up with folks that use the resources that you've shared, and if they do, how are those types of conflicts typically managed?
I'm sorry, I was busy typing
No worries.
Washington State resources. Do you mind saying that again?
Sure. How would you say conflicts are handled, or how might you all think about options for handling situations where different family members might have different ideas of what an ideal housing situation might look like? So for instance, in the voucher program, even people would still be expected to pay about 30% of the adjusted rent amount. And so some of that support, might come from other family members or other sources. And so I guess in instances where people might disagree about whether that housing is a good idea or the type of housing makes the most sense, any recommendations for how to navigate those types of disagreements?
Well, I think we all have views about what are ideal living situations for our loved ones and for ourselves. I think at the end of the day, we don't often have choices that are optimal.
Right.
And so part of it is, I think you have to figure out and maybe come together if it's a family decision, because family members are going to be participating in support. What are the key elements of an acceptable housing arrangement, and see if you can match that to reality. But one might have to test against reality, because it's possible that something would be less than ideal. And then the question is, how urgent is it to actually secure that housing? It's a
the balance.
Anybody who's a real estate agent and this has nothing to do with mental health, all right, or finding housing for people leaving hospitals or moving on to a more independent setting from their family home or whatever, will tell you that the best training to be a real estate agent is social work or clinical psychology or something. And there are many former clinicians working as real estate agents
I have
because
seen that.
it's such an emotionally fraught business, right? Is where people live and how they live.
Yeah.
For all of us, it's got deep meaning.
Yep.
So it should be no surprise that it takes on those dimensions when we're talking about how someone who we might think of as either ourselves as the person or others around us as vulnerable, and people might have opinions about what ought to happen. But it might be that it's important to try to get some help from a third party if people can't come to agreement, who can help people look at what's practically available, what are the needs, and how best to meet those given what frankly are a lot of constraints in the environment. And that has nothing to do with living with one of these conditions.
Right.
Try, for those of you who are parents of a kid of any age who might have been living with you, try helping them find a place they can afford to live, right? Try finding a new place for yourself to live. In Massachusetts, affordable options are very limited. That's why we're fortunate that this governor, the preceding governor, and our legislature have made a substantial investment in trying to develop more affordable housing. And, some of that's controversial. We all read about it in the newspapers that some cities and towns don't want to develop affordable housing, others do. People aren't doing that. Government's not doing that just to be a pain in the neck or annoy local communities. It's because the need is so desperate in our state for sufficient housing stock. So I don't want to paint an unduly rosy picture for people that anything they dream up as the ideal setting could be materialized, right? Similarly, if what you think is that the housing has to have a certain set of services available to it, there are, as Jess was saying, is not a lot of excess capacity in the system right now. So there are some people who are more capable than others at trying to put together resources that exist, like how to bill Mass Health or how to bill an insurer for a service to wrap around somebody. And it's not just publicly funded programs. There are private organizations that do this, provide some of those kinds of services on a private basis. I mentioned before, obviously, what goes on at Wildflower. What is there's a program in Arlington, Ellenberg, I believe it is, that also, I can get you the name of that one, that provides privately funded assertive community treatment services wrapped around people, and they find housing for people.
Okay, wonderful. Thank you. So we just have a couple minutes left of the webinar, so I'm going to move on to closing remarks. Thank you so much, all of you, for your wonderful presentation. All right, so we have some additional McLean resources, some of which are family support groups, people who may have gone through some of these housing situations with other loved ones who could also share some of their experience perhaps with you. And again, I'd invite everyone to take a moment to share your feedback in the feedback survey link that I just put in the chat if you like. If you want to learn more about housing or more about other resources or services that are really relevant to you and your family, please let us know, because this is really for all of you. And then coming up, thank you so much also for the folks who've made this possible. Next month, Thursday, August 14th, 5 to 6 p.m. again, we're going to have our next webinar on digital innovations for family members to support loved ones with psychosis with Dr. Benjamin Buck, actually from the University of Washington. We've had Washington pop up a few times tonight then. And so feel free to tune in for that. And if you have any questions for me, feel free to get in touch. Again, I'm Julie McCarthy, and my contact information is there. I hope you all have a wonderful rest of the night, and take care.